Welcome back to OpenLine. We are talking about health care here in Tennessee. Obviously, the vote last week, and there was no vote. They didn't vote in Congress. They were going to repeal and replace the Affordable Care Act. It didn't happen. They didn't have the vote. So now it is the law of the land. It remains. We're talking about what does that mean here in Tennessee, and it is status quo. That's what it means. We encourage you to call in with any sort of question. We are happy to have with us Sharon Barker, the lead certified navigator for Get Covered Tennessee, and Mary Moore, program coordinator and certified navigator for Get Covered Tennessee. I want to go to Lucy, who's on the line. Hello, Lucy.
Good evening.
Hi.
I have a couple questions and a couple comments, if you don't mind, if
Sure.
you've got the time here.
Go right ahead. Yes.
Okay, well, my first comment is maybe I heard Trump wrong in his campaign. He didn't say he was going to replace. He just flat out said he was going to repeal it. So that got spun off into the stratosphere somewhere with replacing it. If he would have repealed it, then he would have fulfilled his campaign promise, but that's really irrelevant. But the other thing is, I've always followed what people call Obamacare, which y'all call the Affordable Care Act because of the insurance angle of it. I call it the Health Care Reform Act because it covers so many other things than just insurance. And people have no idea how it protects them in so many other ways. Like, you know, I'd hate to go have my toenail removed and then come home and die because I got a MRSA infection. And I'm seeing MRSA infections all the time from simple procedures from people. And I've known a couple that have died, a couple of seniors that have died from picking up a MRSA, and one within 24 hours, and she was healthy as an ox. So that's part of it. The doctor report card, I knew a woman that was in a wheelchair, and for over 5 years, I don't know what happened to her. She had a gaping hole between her pubic line and her navel where she had had an operation, and there was a hole there. And she was on Medicaid, and she kept going to the doctor for years, and he just never closed up that hole. He never made an attempt, but he got paid for that office visit. That's what the Health Care Reform Act was supposed to stop. And the way I understand the healthcare industry, how I followed it over the years, the reason it's all over the map is because it's the only unregulated industry in this country. It never has been, and it never will be. It's a Wild West shootout. And the last thing, as far as premiums go, now correct me if I'm wrong. I'm going to hop off the phone here because I'm all asleep. I'm long-winded. Is that
All right, go ahead.
The only way that those premiums go up, if I understand this correctly, is your state legislature is the one that approves insurance rate hikes. And I've been doing private pay insurance now for over 20 years, and I've got as many as 3 hikes in 1 year, and this is before Obamacare. And I got 3 hikes in 1 year, and it was like 33-35% each time. And then they had the audacity at the end of the year to say that they're enrolling all of us in a giveaway for 35 Priuses.
Okay, all right, let's talk about all that. Lucy, thank you always for calling in. All right, what do you think about some of the stuff she said there?
Thank you, Lucy.
Yeah, really.
That was a lot of information. Well, I mean, I don't want to get split too many hairs about what Trump said, you know, on the campaign.
I think he said, I think he said both. I mean, he definitely said.
I think he did start out with
he said repeal, then he said no one would be uninsured.
He did say everyone would be covered.
He said on 60 Minutes everybody would be covered. So yeah, he said several things. The reform, she was saying, this was meant to be a reform of the overall healthcare system. It's about more than just the insurance. Is that accurate, and in what way?
Well, the patient protections that are afforded under the Affordable Care Act, yes, I think it is more than just insurance. There are so many protections that keep the insurance companies and others from just kind of doing whatever they want to do as it relates to patients. So not being able to deny you for pre-existing conditions, and I think it did some help with the Medicare.
Having to spend 85% of their profits on patient care.
So yeah, I think she's absolutely spot on But the insurance commissioner, I think, is the one that approves the rate hikes. So they do. The insurance companies do have to go and submit those proposals, and the insurance commissioner is the one that determines whether or not they're going to approve what they've requested.
And she called healthcare the Wild West. It will never be reformed. I mean, you all, I guess, can't speak to that, but that's her opinion. Lucy, that's your opinion. Lucy, thank you.
I like Lucy.
Thank you for calling in. Let's go to Candice. Hello, Candice.
Hello.
Go right ahead.
Okay. I think something that is not being totally addressed about the cost of the health care is if you go in and you Google what did the bonuses were paid to the top executives of the companies, the insurance companies, it's a little frightening. I don't have the exact figures, so I'm not going to give out any numbers, but it really opened my eyes. If those top executives, the reason why they shut down, I think, in the States is because they don't think they're making enough money, and they're making millions. It's not, between 12 and 17, it's ridiculous.
Right.
Now, they would address, if the Congress would address that. And the second thing is without exception, all of our government officials have to buy their own insurance. Then they would have to go in and do what all of us common people do in trying to figure out, do I take A, B, C, D, E, F? And they all have just a little tweak to them, but you go through like 7 columns of silver, gray, blue. I'm kind of exaggerating on that.
Right.
But I really feel, that the change in the health care plan was necessary. If anybody would stop and think about what it was like 10 years ago, it had to change. I wouldn't have any insurance at this point in my life if it had not had to change. I cannot pay the premiums that they want right now. I'm getting to the point where I almost cannot pay with the subsidies. So the concept of, pay now and we'll give you a tax credit later, undoable. And I think if the people in our government, if those men and women were said, hey, you know what, you pay it just like John Q. Public pays it, they would sit down and say, whoa, wait a minute, let's get our heads together and really find out how this money is being done and how the insurance companies manipulated the Obamacare.
Let's talk about all that. Thank you, Candice, for your call. All right, what do you think, just off the top of what she's saying there?
I like what she said as far as if they would just get together and talk and say, look, we need to come up with a way to reduce the cost or, increase the subsidies, or they have to get in the room and start talking to each other to see how we can come to an agreement to where it's going to be beneficial to everybody. I mean, the insurance companies, they do have to make money. They're spending a lot of money on services. I don't know that they need to make as much as she's alluding to, because I've seen those numbers too, and they are astronomical, the amount of bonuses people get. So, I think there is a common ground to be had if people would just get in the room and talk.
And that's where we are. And yeah, so she asked about the insurance companies. And some of the, did you have a comment on anything? I
mean, I liked that she pointed out that without the Affordable Care Act, she may not have insurance right now. And I think that's an important thing to remember, how many people have been able to get insurance through the Affordable Care Act. So
yeah, she says the prices keep going up.
Yeah, that's so disheartening. I hated to hear that.
Can be made. But overall, I think it was a step in the right direction.
It was, and I like that she's saying, you know what, even though it is getting to be really expensive for me, I'm glad I have it. I just wish they would come and start talking about how to help me. Even she's willing to say, hey, just.
So what kind of calls are you all getting now? It's not an open enrollment period, but you're there every day, you're taking calls. What sort of calls are coming in right now?
I think the biggest one is, can I enroll now? You know, people that maybe missed open enrollment and they didn't understand that in order to enroll now, you have to have a special enrollment circumstance. You know, you just moved to the state, you just had a baby, you got married, you gained eligible immigration status. You know, those are some of the things that would open the door for you to enroll now. Other than that, you would have to wait till November. So many people are wondering, can I enroll now? Can I enroll now? And then so many people moving into Tennessee, 3,000 a month probably. You know, and some of them are moving from states that they had Medicaid in that state, come here, and they don't get Medicaid. And so we're having to help them to navigate what they're eligible for in this state. And you know, how to, and those that are eligible for Medicaid, then we need to get them enrolled in our Medicaid, because that Medicaid that they had in Georgia is not gonna work here. So we're having to help them navigate that process.
And are you getting a lot of calls? Are there a lot of situations?
Yeah, I mean, with the amount of people moving to Tennessee, absolutely.
And is that a reason to enroll? I mean, if you move, that's a change in circumstance that allows you to enroll.
Right, you're moving to a new primary place of residence, which would be whole different plans available to you in the marketplace that you can take advantage of.
And what about if you lose your job? Are you hearing, if you lose your job and you had insurance, what about that?
That would be another.
That would be
so
another.
anytime you had minimum essential coverage in health insurance, and then you lose it, and it's not voluntary, like you didn't just stop paying your premiums, but if you lost your job, or you got divorced and your spouse was providing your insurance through their employer, you know, any of those type of circumstances, you have 60 days from when you lost coverage to sign up again.
Right. I've even had families where the husband went on Medicare because he retired, but the wife was too young. So she lost the job-based coverage when he retired, and he went on Medicare, so she needed to come into the marketplace to find something because he was covered through his Medicare, but she was much younger, and she lost his job-based coverage because he retired from the job. So those people too come into the marketplace and are able to find insurance.
Yeah,
Okay, all right.
phenomenal.
We're going to take a break. We'll come back. If you have a question, there is the number at the bottom of the screen, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.